Well, welcome to Eyecare Experts. I'm Dr. Bell, Dr. Terrezza, and we have with us today Dr. Montgomery joining this podcast. So we appreciate you being here. And this is a big one. We get the question a lot: why do we have to dilate? Why are you asking me about all my medications, systemic medications that a lot of patients don't fully, I wouldn't say a lot, but some patients don't fully understand the interaction and what we can see by looking in the eyes and how it relates to the body. And so today's podcast, especially with American Heart Month being in February, we're talking about heart health and eye health and how the two kind of correlate together. The connection and why it's so important to get that annual eye exam, why it's so important to dilate so we can see in the back of the eye. And it truly is, they say window to the soul. You can tell a lot by looking in the eye as far as eye health and just systemic health in general.
Absolutely. In terms of disease demographics, hypertension is one of the most common systemic problems in American health. And it's been that way for a while, and it's increasing too. So the risk that you take, in addition to all the other organs of the body, is that if it affects the eye, usually it severs your vision significantly, so that even if you get it under control and get treatment, you still won't have the vision you had prior to the hypertensive event. And those can take a number of, I don't know if I should get into all the complicated diagnoses that go in with that, but it affects the blood vessels in the eye. You can see them in the eye. They can get blocked. You can get ischemic areas. Ischemic meaning that there's no blood flow to that particular tissue, and that doesn't last long. Just like if you don't breathe, you've got 2 to 3 minutes, and then you've got brain damage. So in the eye, I forget what the numbers are on timing, but it's very short, and you lose vision as a function of that. And despite what people say, in the movies, people do well with vision loss. But out here in the real world, it's a very harsh affliction. And most people are not built of steel. And they have a lot of problems getting along with a lot of their tasks, and they get depressed, in which case they develop cardiac problems and other issues, and the whole thing spirals downhill. If I've seen it once, I've seen it 1,000 times.
And I think something people don't think about very often is that the hypertension's affecting younger and younger individuals. They're affecting people at the beginning, middle, and end of their careers. And a lot of times in these younger populations, they don't get sick very often or have chronic health problems, so they're not going to their primary care doctor as much. And a lot of times we'll be able to be the first ones to pick up on some of these findings and even send them to get help with their hypertension.
Well, I know we've had this discussion before, right? It just seems like when I was young, we used to think, hey, he's on blood pressure medicine, he's taking cholesterol medicine, and, he's 45, maybe 50 or 60. But, some of our colleagues and patients, they're 20-something years old, late 20s, even younger than that, especially early 30s, that are already taking, hypertension, cholesterol, medication to help. And so, like you said, certainly signs are going to be, seen a lot sooner. And that's part of what we do is not, certainly we want to see if something's bad, right? If you can't see, you had blood flow or oxygen cut off to the nerve, or you had a stroke or whatever, an ischemic event, we want to see you. But our job for doing an annual exam and seeing you periodically is hopefully to prevent it from ever getting to being that bad. If we look at it and we see, we can tell a lot, whether it's tortuosity of the vessels, whether it's venous dilation, maybe there's a plaque in there, maybe there's neo where we can tell that the blood flow is not operating like it should. Certainly we want to look at those things and try to be proactive and hopefully prevent it before it ever becomes an issue or becomes permanent vision loss.
The big principle with any disease, and this is just a basic fact, the earlier you find the problem, the better off you are, and the better it is and the easier it is to control. It reminds me of a saying at Alabama where I went to school, and they used to say, it's what you don't know that kills you. And there's a lot of truth to that old country saying. And if you don't know you have the high blood pressure, you're tearing things up and you don't know you're tearing them up. And that's not a good place to be.
Well, I think the positive nowadays is I believe between us, optometrists, ODs, and the relationship, we've always had great relationship with specialists, retinal specialists, ophthalmologists in the area, but I think the correlation, whether it's be pediatrician or general practitioners, I think everybody as a unit is doing a better job of referring patients to each other, you know, getting all the referrals in, getting all the literature. So, you know, whether it's a primary care and they're treating you for, you know, some new medication to help you with that blood pressure, they and, you know, everybody sees the value of coming in for that exam, that full eye exam. That way we can monitor health that way. And it hasn't always been like that. I know when we first started, it wasn't like that. But I think for the patient's benefit nowadays, it is like that. We're kind of team. Hey, they're treating you for this, we're treating you for that. And we want to work together to make sure you're the healthiest you can be, and the chances of you having any issues, whether it be systemically or with the eyes, are at least as low as we can make it.
Medicine has evolved.
Yeah.
And I think a big part of that is the addition of physician assistants and nurse practitioners, especially, who are aware of that and then refer out for it. And certainly we take, I don't want to say 99, but I'll say 98% of all insurances out there.
Yeah, for sure.
And under those programs, you can come in and see us, and those medical visits are covered by that insurance.
And yeah, to that point, I mean, we take 98, 99%, and vision insurances, yes, we take that. But, you know, if you have medical insurance, you don't have vision insurance. If we find a medical diagnosis, whether it's hypertension, whether it's, you know, this or that, whatever it is, it could be dry eyes, could be allergic conjunctivitis, you know, we can bill your medical insurance. So certainly give us a call, come in. We want to do, whether it's a comprehensive exam you haven't had in a while, maybe it's, hey, I'm a little blurry in this eye, or maybe there's a pain, or you feel pressure. It could be anything. There's a red eye. We want to get you in. We have certain slots in the schedules at all the offices, so we can work in emergency visits, work in, you know, whether it's whatever the situation is, whether it's same day or next day, we want to get you in and get you seen.
We have a 5-person insurance team full-time that bills those medical insurances, keeps up with the payments. You don't do any of that. And as far as I know, we're one of the few that has that. And so we're on most of the plans. So you'd be surprised. The question is not whether you get examined for glasses or not. The question is, why are you not seeing well? And to get to that why, you have to do diagnostic tests, which you have to have the equipment, the space, the personnel, the technicians, and everything else to come to that conclusion to say, oh, this is just a case of your glasses need updating, or hey, you have this and this, which indicates you have a thyroid condition and you're going to have to see an endocrinologist and get that fixed first, and then we'll go after this. And getting that order right and doing, you know, God's only given us one pair of eyes, 2 eyes per individual. It's got to last you for the whole shooting match. And so it'd be good to take care of them. And that's what we take seriously.
Yeah, and I would say don't delay about coming in. I have so many patients who want to wait till their vision insurance is, they're eligible again for their vision insurance, when I could have seen them a couple months prior and gone medical for them. So don't delay. We'll take care of what needs to be.
And the good thing at each of our offices, because we all, you know, want to check all the medical conditions that we're speaking of now, and anything that can affect the eye. Maybe it's as simple as, hey, you need a new pair of glasses because your prescription changed. But it could be, hey, you have fluid building up in the back of the eye, you have bleeding from hypertension or blood sugar or something like that. And so we have the tools, whether it be, you know, retinal photos, wide field imaging. We have autofluoresce nowadays. We have angio. We have OCTs that can scan anywhere in the back of the eye. We have B scans. We have maculagic. We have color vision test. We have all of those things because we see the value in being able to assess certain individuals and being able to kind of monitor even the slightest changes or progression in whatever condition it is. Maybe we're speaking of blood pressure and hypertension today, but it could, same is true for Plaquenil, same is true for thyroid, blood pressure. We want to monitor and make sure it's not getting to the point where we need to get you to a specialist or we need to take care of it.
That's correct. And that's very valuable to you, and that's what has a significant overhead to it. So therefore, if remember what Warren Buffett said, and it applies to eye care. Price is what you pay. Value is what you get. And so with us, if you didn't have those machines, you couldn't put the value into the thing. You're making assumptions about the eye system, and that can be dangerous because it's your eye at risk.
Well, and that makes me think of how I get the question a lot, how often do I need to be seen, doc? You know, how often should I come in for an eye exam? Well, if everything is healthy, most of us will say once every 12 months, maybe 24 if you're young and everything's good. But with certain conditions, let's say it's someone who has high blood pressure. Well, you know what? Maybe once a year is not good enough. Maybe we need to see you, every 3 months or 6 months or 9 months, based on how severe it is. I know with diabetic patients, based on whether it's mild, moderate diabetic retinopathy, we see them at certain times. So, that is where we assess you that day. Let's see what you got, and we formulate the plan of, hey, let's go this way, or let's monitor, let's treat you. But we want to stay on top. We want you to be a patient forever, for life. I mean, we want to certainly take care of your needs today, but we also want to take care of your needs in 6 months or 2 or 4 years from now. And that's the way we go about it is, hey, we want to do a short-term plan, but we also want to establish a long-term plan as well. And I think, certainly only you can benefit from that because, if things can present themselves and maybe it's a one-time issue, but there's a lot of conditions that we see that are going to become chronic issues. And it could be worse the next time, and so we want to make sure we're doing all we can to minimize that.
I agree 100%. And I'm happy that we're certified under most insurance plans, except the 1 or 2 short-sighted that are cheaper to get, but certainly don't cover the medical side of your eye care. And I'd be very careful in choosing your insurance and making sure that there are providers that can do that for you, as opposed to getting the short end of the stick, which has occurred particularly in the last 2 years.
Well, I know for us, we are transparent in the sense that we're not going to try to stiff you at the end and do this and say, oh, by the way, you owe us this amount. From the minute you check in, whether it be the front desk, whether it be the tech, hey, this is your insurance, this is your copay, have you met your deductible? So you'll kind of know where things are at. And kind of going through it. Our job is certainly to lay out, hey, these are the conditions you have. We want to show you, whether it be photos or and answer any questions you have, and then kind of go from there. Anything else we haven't covered in blood pressure? Just kind of making sure. I think the point is, don't keep putting it off. I know you said that. Certainly, the earlier we catch it, the better the outcome. So if it worries you, it worries us. So give us a call. Certainly blood pressure issues, cholesterol. We don't want you to have an ischemic event. We don't want you to have a stroke. We want that blood flow, oxygen to remain there. And like you said at the very beginning, if we see that in the eyes, you better believe it's in the body as well.
That's correct.
And I know there's been times through my 21 years where I've seen patients and they didn't know anything was wrong. They came in because, hey, they weren't seeing well for a DMV driver's test, and we look in the back of the eyes, and it's something serious. And if they hadn't come in, I don't know what would have happened.
I want to give them this piece of knowledge. This is very deep. So as you get older, you fall apart, okay? So to do that, just like with a car, you're going to need more maintenance. And if you're smart, you'll do the maintenance on the front end instead of on the back end and wait till something breaks. That's traditional American medicine. That's why our ERs are full of people that say, oh, this is a sudden problem. It's not sudden. It was gradual and got worse most of the time. You could have hit it when it was gradual and not suffered the heartache, the economic expense, and all the effects to you and your family.
Adding on to that, I think it's important for people to know when to come in. What are the worrisome symptoms that we see, especially with cardiovascular disease, with your high cholesterol, hypertension. My big warning sign that I hear is, a sudden decrease in vision in just one eye. Unusual for it to happen in just one eye. Vision that dims, even if it comes back afterwards. If you're having episodes of your vision dimming, we want to see you. That's not what we expect. That's a problem with the blood flow going on. Or anything that looks like, the top half of your vision, like it's you're losing it, like it's curtains going down. Those are all related to blood flow in the eye. Those would be the things I would be worrisome about if I was experiencing.
All good points, all
Yeah,
good points.
For sure. Well, we appreciate you viewing the podcast, and thank you for listening to us. Whatever we can help you with, whether it's a full exam, whether it's an office visit, whether it's a, just a vision issue or a health issue, we do both. And that's the way we've always kind of done things, because if we want to get people seeing the best, we realize we've got to treat the health part of the eye to accomplish that. Stay tuned for next podcast. We appreciate it, the Eye Experts. Thank you, guys.
Thank you very much.